Today we're going to talk about head, neck, and shoulder pain. Often head, neck, and shoulder pain is created by a muscle imbalance of the upper quadrant known as the upper cross syndrome. The muscles that are involved that are too tight are often the pectoral muscles in the front, followed by the suboccipital and the trap muscles in the back of the neck. This is also seen with weakness in the deep neck flexors of the neck, with also weakness of the mid-scapular muscles in between the shoulder blades. So today we're going to show you 5 different exercises that can help to fix that underlying muscle issue and prevent the bad posture that's often created with upper cross syndrome. Frequently we'll find patients with upper cross syndrome that have forward head posture where their shoulders are slumped forward, the head comes forward as well. This creates a lot of tension in the upper neck, creating tension headaches, neck pain, degeneration of the cervical spine. Also with the internal rotation of the shoulder, we can create an impingement and rotator cuff injuries in the shoulder. So today, again, we're going to show you 5 different exercises that can help you fix your own head, neck, and shoulder pain. For our first exercise, we're going to show you the scap push-up. The difference about this push-up is that we're actually going to keep our elbows locked, and all the movement's going to come from the shoulder girdle as it moves around the thoracic cage. In the upper cross syndrome, the tightest muscle that occurs is the pectoralis minor muscle. It attaches to the shoulder blade and keeps the shoulder blades pushed up and stuck to the thoracic cage. So we're going to try to initiate some good movement here to allow that muscle to relax. So it looks like this. We're going to do this for about 10 to 15 repetitions to really get great movement of those shoulder blades. From our push-up position, we're going to keep the elbows locked, and we're simply going to allow the shoulder blades to start in a down and back position. This is called a scapular set. From here, we're just simply going to allow shoulder blade movement as we move only through the shoulder girdle. And again, we'll do about 10 to 15 scapula push-ups. That's good. For our second exercise, we're going to show you a pretty famous postural exercise that's called Brugger's posture. This exercise is to reverse all the muscular tightness that we see with the upper cross syndrome that is frequently seen with people who sit behind a desk too much. If you think about it, when you sit behind a desk, often you sit with your shoulders rolled forward, your head slunched down looking at the computer monitor. In this exercise, we're going to reverse all of that. So we're going to stand up really nice and tall. I always try to tell patients, think about a string pulling your head straight to the ceiling. And from there, we're going to roll our thumbs backwards as far as we can. What this does is it rolls the shoulder girdle backwards, stretching the pec minor, opening up the bicep and the forearms, and allowing for even the carpal tunnel to open up, as this exercise is fantastic for carpal tunnel patients. So we're going to hold this position for about 15 seconds. Take a deep breath in through our nose and out through our mouth. And then we would just simply return back to work. For our third exercise, we're going to show you a wall sit. This exercise is designed to help fix the increased kyphosis, or the too much flexion through the upper thoracic spine that occurs when somebody has the upper cross syndrome. So again, when the pectoralis minor and major muscles get too tight, it rolls the shoulders forward, and this produces this kind of hunchback, if you will, through the upper T-spine. So this exercise is great to help fix that and help fix a lot of the problems associated with the upper cross syndrome. So it simply looks like this. We're going to sit on a stool or a ball about 15 inches away from a wall, and we're going to put our elbows up on the wall. Our forehead goes right onto where our hands are, and from that position we're going to simply take a deep breath in, and as we breathe in, we're going to extend through the upper thoracic spine. This again helps to kind of mobilize that upper spine, which can help to create you be more flexible and improve your posture. So it looks a little bit like this. We sit again on a ball. I love these big exercise balls. Spread our legs really wide, put our hands up on a wall, and put our forehead right into our hands. And from this position, simply just take a deep breath in and let it back out. And as you breathe in, try to really extend through the chest as you breathe in. So again, like this, breathe in and let it back out. Breathe in and let it back out. It's a very simple exercise, and it just requires about 10 to 15 repetitions, but it can be great, again, for loosening up your upper thoracic spine. Our fourth exercise, we're going to use a foam roller. These foam rollers are great for rolling out your quads or your IT band, but they're really helpful for actually improving your thoracic posture. So what we're going to do is similar to that wall says, we're going to try to develop good extension through the thoracic spine. It simply looks like this. We're going to place this on the ground or on the floor, and from this position just simply roll backwards onto the roller, and from here roll back and forth. And what this roller does, it just helps to put your upper thoracic spine into extension. And you can roll back and forth for 30 seconds to a minute. It's a pretty simple exercise and it really feels good. For our fifth exercise, we're going to show you a push-up done on a ball. Now we're going to use a ball or any other type of unstable surface like a wobble board or a disco sit or something along that line that creates an instability of the shoulder. And the reason why we want to do that is because that instability will actually make the body recruit the shoulder stabilizers, not just the rotator cuff, but also the serratus anterior muscle, a muscle that sits on the front of the shoulder blade between the rib cage and the shoulder blade. And that muscle is really important because it pulls the shoulder blades down and back and produces good shoulder posture. So again, we can use any type of unstable surface. So in this case, we're going to use a soccer ball and a mini basketball. And you could do this off your knees, or here I'll do it off my feet. But again, what we're going to do is we're going to be in this position, and before you start, two things I want you to pay attention to. One is bring the shoulder blades again down and back before you start. That's what we call a scapular set. And then from here also, I want your hands to be pretty equally weighted. I don't want you to be on the outside of your pinky finger. I want you to be pretty well level on both sides of your hands. And then from this position, just simply go down and do your normal push-up. How many you do? Well, that's just dependent upon your ability. But as you can tell, it gets a little difficult as this unstable surface. But it's a great way to recruit the shoulder stabilizers and produce ultimately fantastic shoulder stability. Again, these exercises should help to fix your head, neck, and shoulder pain.